Hey guys, my name is Ibarra, currently attending Grand Canyon University, going to my junior year. I'm majoring in biomedical engineering. This summer I got the pleasure to work with Dr. Margolis in his orthopedics research lab. The research that our lab focuses on is developing cartilage and bone regeneration techniques. The main research question is, how can large bone segment defects be repaired in the long bones? Segment defects is when there's a sizable portion of the bone missing. This results in the bone not recovering as well and scar tissue growing in its place. And potential cause of this would be surgical removal. Many cases of this is due when there's a tumor growing on your bone. And another potential cause is by traumatic injury. This is prevalent in active military members. In the US, there's approximately 6.3 million bone fractures every year. Many of these injuries are going to be associated with long bone segment defects. There are a couple possible treatments for long bone segment defect, including the vascular bone graft and allograft. But such treatments do not work as well and have a high complication rate. To combat this, our lab is trying to engineer a solution that would allow the patient to regrow the bone in the affected area. This solution entails a 3D printed scaffold being implanted in the affected area of the bone with stem cells. This approach is supposed to increase the bone growth significantly to the point that the defected area is eliminated. Currently, our research team is trying to find different materials to make the scaffold instead of polybutene terephthalate, or PBT for short, due to the fact that PBT scaffolds do not dissolve in the body over time. Therefore, our lab is trying to make scaffolds out of polyitic acid, PLA for short. This material dissolves in the body, making it more valuable to be used in clinical trials. This is where my work comes in. This summer, I'm using CT scanning analysis software to measure the volume of the leftover scaffold and bone. I am conducting these measurements from CT scans taken from animal models that had implanted scaffolds to test PLA is a more valuable material for scaffolds to be made out of than PBT. Alright, my final two questions are, first, will the rat models with a 50-50 ratio of PLA and TCP scaffold have the most bone growth? And second, will the PLA coated with TCP scaffold replace the mainly used scaffold, which is PBT scaffold coated with TCP? Thanks for watching.